There's no more important issue for us to consider than AIDS, says UN Secretary General Kofi Annan. It's true. It's a global crisis, a major leadership challenge.
It threatens to shred the social fabric of any country.
HIV/AIDS is a global pandemic, devastating in its impact, and Africa is the epicenter.
It's clear that the whole continent of Africa is being racked, that their economic progress is coming to a halt.
It is more than a public health crisis. It jeopardizes every developmental gain and the very future of the continent.
There is nothing more paramount right now than an issue of survival.
More than 20 million have died. Millions more are infected. And still, millions more are at risk.
This is unacceptable, and we have the means to stop it.
African mayors assemble here at the Afro-Cities 2000 Summit in Windhoek, Namibia, to assess progress and fine-tune specific plans for the future. These mayors and municipal leaders have formed an alliance, an action program called AMICAALL, with help from the United Nations Development Program and UNAIDS to strengthen the fight against HIV/AIDS at the local level.
AMICAALL is a translation into an action program to be implemented in every local authority which is a member of the alliance. And it stands for African Mayors Initiative for Community Action on AIDS at the local level.
Local leaders exchange their experiences and get updates on the spread of HIV/AIDS.
The epidemic effects may seem overwhelming. The sheer numbers, 33 million people infected with HIV. Another 17,000 people will be infected today whilst we are talking. They can be mind-numbing figures. But we have within ourselves, we have within our communities, we have within each and every one of us the ability to respond positively.
Mayors have pledged to respond positively in more than 18 countries and over 70 municipalities to unite their communities. And many more countries are expressing interest in joining.
The initial core group that came together to create the alliance included mayors from both East and West Africa. The big push, though, did come from a group of French-speaking West African mayors. And here I really have to give a great deal of credit to the mayor of Abidjan, Mayor Mobio, who has just been tremendous in terms of his support, his outreach, his mobilization.
Depuis notre réunion d'Abidjan,
Since our meeting in Abidjan in 1998, which gave birth to the alliance, we have worked together with our partners to strengthen this alliance. We are making progress. And we believe we have become more effective in mobilizing both human and financial resources.
Our major role is to enhance the value of civil society, to enhance the value of NGOs, and utilize the local resources. Really, it is the work at the community level that we support.
The fight against HIV/AIDS can only be won if there is strong partnership. An initiative that starts with the involvement of government but goes and mobilizes the support and the partnership of all members of society.
Specific action programs are being implemented to mobilize resources, coordinate local services, and Educate, educate, educate in every tribal language.
Do you think you can live with people who are HIV positive? No! I can hear you! No!
I would call on Africans to look at how we can not only prevent the spread of HIV/AIDS, but also for us to look at people who live with the virus, with HIV/AIDS, as individuals who are like us and who need the attention that they should be getting.
There are many people who are like me. They want to come out, but they are afraid of how your community treat them.
You're wasting our time. No time for speeches. Let's ban this dog.
The police!
People living with HIV are potentially tremendously important in terms of promoting change. They're really strong agents of change, provided, of course, there is an enabling environment which supports them in terms of being public and not being afraid to lose their homes, their jobs, their families.
These efforts are aimed at breaking the silence and countering superstition, fear, and an unwillingness to discuss sensitive topics.
What is very unusual in this mobilization against HIV/AIDS is the attention which is being given now to breaking the silence around this issue.
We've been now 20 years in this epidemic. Let's face it. Let's face it. This is a sexually transmitted infection in Africa. I know many of us would be very comfortable if it was not the case. They would be very comfortable that it is coming from outside, from a mosquito or from the air or from I don't know what. But this is not the case. It is sexually transmitted.
AMICAALL also coordinates help for survivors of the pandemic, children left without parents, women forced to head households, and the elderly left with few resources.
The reason I think the Alliance is very innovative is that it works with three key stakeholder groups together. It brings together local government, brings together civil society, and it brings together communities together and not separately.
The role of the mayors is essential because Africa is rapidly urbanizing, according to UNDP urban specialist Jonas Rabinovich from Brazil.
Africa is the least urbanized continent, but at the same time is the one that's urbanizing the fastest. So some areas in Africa are urbanizing at 8% a year. Tremendous urban and peri-urban growth. So this means that a generation from now, most poor and most people in Africa will be in urban areas, in cities and towns. And there will be a need for these cities and towns to have the necessary managerial instruments to deal with the pressing problems, and HIV/AIDS is perhaps the most important of them.
U.S. Congressman Jim McDermott focuses on the impacts of the AIDS crisis in Africa.
The life expectancy in a number of African countries has fallen from 50 down to 30. And that is, in my view, almost a death sentence to the economy if you don't begin saving young people. The United States has spent a good deal of money in an effort to combat the AIDS epidemic in Africa, but had very little effect. In many ways, I think, because they did not really use the local people.
What I think has been particularly effective about this approach is the partnership. Much has been achieved, and what I see emerging really is a solidarity movement. During this time, a number of countries have launched chapters of the Alliance, like Swaziland, where the entire country has been mobilized.
We are very much encouraged by the fact that His Majesty, the Head of State himself, has taken it upon himself to personally get involved. I think that has made quite an impact, that, if His Majesty can pronounce on this, and of course he's declared it a national disaster, then it does have an impact. Our society is a very traditional one, and so when His Majesty speaks on an issue, people do take notice, and so I think that has been one major step to try to bring the issue, in a much more realistic way to people, in the wider populace.
So the Alliance, in realization that we have to put our money where our mouths are. We have to be action-oriented, came up with a strategy which is the heart of the alliance, the pulse of the alliance, a blueprint for action.
This blueprint is based on partnership principles enunciated by the United Nations, including respect for human rights and community-identified priorities. Action defines the AMICAAL approach here in South Africa, where a new chapter was launched in November 2000 with a march and a ceremony. This energetic mobilization was noticed thousands of miles away in Washington, D.C., where 16 members of Congress signed this strong letter of support. Democratic Representative Juanita Melinda McDonald was one of the signers.
It is so important for AMICAAL to go into South Africa because it taps the very source, the very essence of the beginning of our finding the solution.
The AMICAAL solution is again to focus local expertise and local initiative on a local problem, so people will feel comfortable about talking about it, feel comfortable about dealing with it, and have that local support as we generate solutions.
Support in the U.S. Congress is bipartisan. Republican Jim Leach.
It is very important that local leaders lead. And what AMICAAL symbolizes is a step towards honesty and a step towards forthrightness, which then can lead towards solution. But without recognizing a problem, no problem is going to be resolved.
If looks could kill, woo! Candy DeGraw and Amy Kimberly.
Getting politicians engaged is critical, but getting people around the world involved may be more important.
Thank you.
Amy Kimberly is an anti-AIDS activist in Telluride, Colorado, who has organized events to fight AIDS in Africa with help from the UNDP.
This year, TAB is expanding far across the ocean to sub-Saharan Africa, where there really is an extraordinary problem. I hooked up with AMICAAL and the Mayor's Alliance, and it was the thing that appealed about the program was it's people helping people. There is not a lot of bureaucracy involved.
Kimberly helps stage fashion shows to raise awareness and encourage her neighbors to support a person-to-person AIDS project in Swaziland.
Well, what happened was I was lucky enough to hear these mayors speak. So I was moved just by their words and the stories they told, and the fact that they had come over and they were appealing. I was at a national conference on AIDS. It was held in Denver, and they came over to appeal to the very people that had helped combat it here. They're saying, you guys did it here, can you help us there? I just want to take a moment to read a little bit from a letter that I got. I got two letters, one from the ambassador of Swaziland, and this is from the mayor. Our people are dying in numbers, especially women and their children, and your endless effort is greatly appreciated by us all. May God bless you, Fikile Matembu.
AIDS is a disease that actually by the time you die, it has deprived you of your human dignity. Fellow mayors, I think this is a battle that has to be fought by Africa. Your people chose you because they had confidence in you. I believe that we have fought so many wars in this country and we won. Why can't we fight this epidemic?
The issue is ultimately it's one of humanity, and what we would wish to say to those of our friends in the international community who are not perhaps so much focused on it, that it is a human catastrophe which threatens, in some cases, you could actually wipe out a whole country, and I think it is not beyond them to respond to it.
As leaders at every level in Africa begin to work together, more effective responses are emerging. In December 2000, UNAIDS reported a slight decline in the spread of the pandemic.
I'm very glad that African leaders, particularly at this local authority level, have decided to cooperate, and this is the only way.
Africa has to wake up. This scourge is destroying our young people. We all have to join hands and definitely combat it.
Please join us. Launch in your cities. Make a difference.
We can save and ensure the existence of our nations, to preserve our continent for our future generations.
Nampasi na motema sango yako kakite Petit François tiki biso ye